now to move to joints. Yay, how we move. So there are types of joints. The first joint we're going to talk about is a fibrous joint. You don't need to know the fancy term, but it's syntherosis. Some of these things I can't even say. These joints are immovable. They're connected by fibrous connective tissue. Remember how I was talking about the skull? Mm-hmm. This is a fibrous joint. Okay? So these joints generally are not going to have any issue with yoga. We're not doing an asana posture that's going to shift our frontal bone of our brain. So you don't really need to pay attention to it. But you'll see there, like, it's really cool where you see the skull going deeper. It's a suture line. And this is what you were saying before, like babies. So these are big when they're born, and then they suture together as the bones grow. Right. Yeah, it's pretty cool. And then there's a very dense amount of connective tissue around that. So I like to explain connective tissue. You'll hear the word fascia. It's the same thing. Okay, but people think of fascia more in the way of like, oh, it's the encasing of the organs, but they both, like, connective tissue literally goes throughout the entire body. It webs itself inside of our organs. It is like the coolest, like, spider web. It is its own ecosystem. It is really cool, fascia. And fascia, a lot of times, is the gatekeeper to the trauma that lives inside of the muscular tissue. And so often our fascia gets tight. So I like to consider fascia like the shoe. Muscle is the foot inside of the shoe. So often when we have an injury or something happens, our fascia gets tense, our connective tissue gets tight, and it's like we're wearing a shoe one size too small on our body. Yeah, but you see people moving around, and you can tell, right? So our connective tissue is everywhere inside of our body. The easiest way to explain it is, if you ever on a chicken breast, you see that white film? Yeah. That is connective tissue.
Oh. So you said it was the gatekeeper of what?
So I call fascia the gatekeeper to your muscles, especially the trauma that might be housed in muscles. And so often the fascia will get really tight around muscles that have trauma to them because it's just trying to protect the body. Now we see here a few other joints. There is a part of our radius and our ulna that actually don't move and other parts that do. I'm not going to go into this because I don't want to confuse you, because you have supination and pronation, but there is this fibrous tissue in between them. Okay, so you see that? There's fibrous tissue also in between your tibia and your fibula. And then if you notice here, you don't need to know this for yoga, right? But it's in your teeth, this joint. But we don't really need to know.
That picture C looks like a vagina.
No, it's your tooth.
It actually does. Does not look like a... I have to look twice.
Okay, so next one, this one is going to be a joint that is gonna affect yoga practice, is your cartilaginous joint. These joints allow limited movement, are connected by cartilage. Okay, examples: intervertebral discs, your pubic symphysis, which is your pubic bone, where it comes and it attaches into your ischium and your ilium area. And if you see there, the pubic symphysis is this middle part, so your pubis actually comes together and it connects. It's not a bone right here. This allows more flexibility on the right and left side of your body. That's that plane we were talking about. There literally is like a plane going right through the middle of us.
Smile for Dr. Ben. Courtesy of pelvic bone came from Dr. Percival.
So that's one
Not
of these.
literally.
That's one of these areas. The bigger one.
His yet.
Yes, thank you for these. The biggest one is more in what you're going to have in yoga is the discs, which you'll be affecting more than the pubic symphysis.
You guys should have asked Brad. Brad has a whole spinal column in his office.
Nice.
Oh, really? And a brain. A ball.
All right, the next joint is synovial joints. This is, Tiffany, you were asking about like the shoulder and stuff. So synovial joints. These joints are freely movable and have a synovial cavity filled with fluid. So when you were saying you have a bursitis, it's the bursa sac that's also encased inside of synovial fluid, and it got irritated for you. Okay, so there are several types of synovial joints. There's hinge joints. These are your elbow and knee. So you have allowing flexion and extension. It only does this and this. It only does this and this. It will only do this. It does not want to do this. Remember I said like your knee? Yeah. It does not want to do that. Its main thing, a hinge joint, it hinges like a door hinge. Okay? Ball and socket joints, the shoulder, hip, they allow movements in multiple directions, but also rotation. So a ball and socket joint can hinge, right? It can go forward and back, but it also can go in a circle. That's why if you saw here, the ball goes in the socket and then it can just move around. Pivotal joints. So these are your atlantoaxial joint in your neck. That's what we were talking about, C1 and C2. Okay, it allows the body to do that. Condyloid joints. These are in your wrist. They allow movement, but no rotation. So your wrist, well, you can go like this in your wrist, but right here, these bones, remember how I said they allow you to move this way, but they're not gonna really move much.
But this rotation is from.
That's not from that is pronation and supination. That is here. We're gonna talk about that in a second.
Okay.
So why is the wrist not a hinge joint?
Because it can do this too. So it can do this and it can do this. It can technically do this, but it's not the ball inside of the socket doing it. It's technically you go like this and then like this and then like this and then like this and then like this. It's not like a shoulder. It's different. It's a slow movement of these two movements. Now, when you're pronating and you're supinating, the wrist is in an effect. It's not, the wrist itself isn't moving. You see how the bone moves, not the wrist? The wrist isn't moving in that movement.
Yeah.
It's the bones, and the bones are just, they're rotating, the bones. Saddle joint, there's only one of them in the whole body, and it's your thumb. It allows movement in two planes. Our opposable thumbs are what make us humans, right? Without that saddle joint, we couldn't do many things, especially scroll on Instagram. which is devices are jacking people's saddle joints up, by the way, causing many issues for people, are creating arthritis in this joint that should have never developed it because we're overusing it. It's not meant to be used that much.
So what does the shoulder have that the thumb lacks in terms of?
It doesn't have a ball in a socket. It's a
What
saddle.
can't the thumb
So it can't go in a pure circle movement.
same thing.
It's technically if you look in the hand, and you can see it in your book, but if you look in the hand, it's the coolest joint. It literally looks like the bone is saddling up like a horse saddle on top of the other bone. That's why they call it a saddle joint.
Huh.
And then plain gliding joints. Again, these are the carpals and the tarsals. Remember I told you they have a little bit of movement, but they can't really move a ton. A plain joint, though, has more movement than if we went up above than a fibrous joint has. So like the carpals and tarsals can move more than the bones of the head. So they do have more movement because they don't have all of that fibrous material in between them. Make sense? Okay.
So if I was gonna flip somebody off, I would be doing
Energy.
You would be supinating. You would be flexing your wrist,
Flexing and then
and you would be extending your phalange.
And then, okay, and then it would be, what is that?
You're extending your phalange, and then when you take it down, you're flexing your phalange.
Cool. I was thinking at the very tip, there's a joint right there too, though.
There's
right?
3 phalange bones in your middle finger. 1, 2, 3. So you have, wherever there's a knuckle, there's 2 bones that meet at that knuckle. So you do have them here. Like, there's 2 in your toe, so you have 1, 2, 3 phalanges, because there's 2 knuckles.
It's the verge of your feet, then,
No, but there are joints in there. They're hinge joints. This is a hinge joint. What does your finger do? It can only go this way, just like your knee and your elbow. It's a hinge joint. So, relevance to yoga poses. Hinge joints are affected by downward dog, forward fold. Okay, downward dog, we're hinging our knee, right? You see that? Forward fold, we're hinging our hips. Get it? All right. Ball and socket joints. We have here the movement is flexion, extension of the knees, and they say the elbows too, because in downward dog, you're stretching them. I forgot to bring the elbows into it. Ball and socket joints. Poses are warrior 1, warrior 2, and tree pose. So again, warrior 1 and warrior 2, you're standing, but you're allowing your hips to have 2 separate movements. This ball and socket joint is hinging more. This ball and socket joint is actually opening more in the circular movement. Make sense?
Yeah.
So these 2 joints are doing 2 separate movements at the same time.
Your headlights.
Yes, they're still headlights, but this joint of the right leg is doing more of the circular movement of the ball and socket. This is doing the hinge movement of the ball and socket. And then tree pose, right? You're opening up your hip. Okay. It does say abduction and adduction are also occurring in these poses, but abduction and adduction is occurring in a lot of poses. The second you make your feet wider, you're in abduction and adduction. Pivot joints. So poses for pivot joints, head rotations and seated poses. Like Lord of the Fishes pose is rotation of the neck.
What's Lord of the Fishes
What's
pose?
this?
Yeah, that's Lord of Fishes.
Oh, I'm gonna go show.
It's like
What?
Matsuyama or something.
Oh, a break? Oh, can I have like 2.
Yeah, finish that one.
Yeah, finish this up. So we have here the head rotation. So that's a pivot joint, right?
Yeah.
Remember how I told you your head can go around? Condyloid joints. The poses, wrist movements like plank pose and handstand. You're going to teach plank probably more than handstand, but you're moving your wrist in those. You're activating your wrist. I don't say focused. Like, you're not going to be having to pay attention to like, oh, I'm doing a pivot. I'm having a pivot joint here because I'm supporting the wrist. The ball and socket, the hinge joints are, I think, more of the joints that you're going to pay attention to more as a teacher. Saddle joints, thumb positionings, and several mudras, even in down dog, if you put your hands the right way. But mudras are going to do saddle joints, and then plain gliding joints, movements in the wrist during arm balances and transitions. So when you're moving your hand, you know how you're moving the weight, or you're transitioning from like plank to side plank, you're going to have the gliding joints be affected. But as I said, the first 2, ball and socket and hinge joints, you're gonna be, as a yoga teacher, paying a little more attention to those. Any questions? Yeah.
I had a question about plank pose, like when if we go back to how you're doing it, about the shoulders, like, what do we need to make sure that we're doing correctly? Because, like, I know people that when they're coming down, like, there's a lot of pressure in your shoulder joint, so is there a good way to make sure that you're not injuring yourself through?
Well, plank pose, your shoulders should be directly over your wrists. You can help them with that. The second thing, and I like to teach it, even men will understand this, but where your bra strap is, feel like you're tightening your bra strap, one strap too tight. You also, some people say feel like your shoulder blades are gently squeezing together.
So that always has to be back as you're coming down.
Some people can feel like the shoulders are moving back and down, but as you're coming down in plank pose, you're not supposed to be moving the spine yet. You come down and then you begin, and some people start doing their back bend before they get down.
Okay.
But if you're cueing correctly, your spine is supposed to stay straight, and it's activating of your core. But for some people, just telling them to activate their core in plank isn't enough.
Yeah.
They need to think about the back of their body. I've just noticed in the years of teaching, so that's where it's like, but you need an engaged core to do it properly.
Okay, thank you.
You're welcome.